Thank you. Thank you so much, Poonam. Thank you, Poonam, and thank you to Cisco for inviting me back again and giving me this really awesome opportunity. I'm really looking forward to learning from all of you. Uh, feel like I learn more as I teach or I kind of share. So let me share my slides. We can get started. So I hope everyone can see the slides. Yeah. Um, I'm Dr. Leena Khanzode. I'm a child, adolescent, and adult psychiatrist. I am, right now really grateful to be able to give back to the community by a couple things I do. So I trained at Stanford. I did my adult and child psychiatry residency at Stanford. And before that, I'm originally from India, immigrated about 24 years ago. And I also did a residency back in India, in Mumbai. So I have that kind of a unique experience of training both in the West and the East. So that helps me, I guess, to be a little bit more culturally sensitive, in some ways to do my work. And then after I graduated, I wanted to give back to the program that got me to a place where I wanted to be. And so right now I'm an assistant consulting professor at Stanford. I do teaching and supervision for the child psychiatry fellows in training. So it's very humbling to be on the other side where I had a supervisor many years ago and I was a trainee, and now I'm on the reverse role where I'm supervising and helping other child psychiatrists become, great doctors. Uh, and then I have a private practice. It's called, Silicon Valley Psychiatry is the name of the practice. I have been in practice now for, gosh, like 14 years. And, I enjoy my work. Really happy to have that, you know, place for me to be able to do the work that's so meaningful for me. And then, during my practice years, after about 5 years into practice, I was starting to see a lot of pain in the community with teens starting to have mental health challenges more. And that was very, very jarring. It was very, disturbing. And I was starting to kind of wonder, what do I do to help the larger community? Because in my practice, I see a handful of people in coming into my office, but what can I do? And based on my experience at work, I realized that by the time people come to my office, it's like a little bit late in the game where the child is possibly needing a lot more interventions, possibly medication. And so my big learning was that there was a lot of lack of education and awareness about picking up mental health challenges with kids and teens in particular, where particularly they have such a unique kind of phase of growing at that time with their moodiness and stuff. So it's often hard for parents to pinpoint what's going on. The other factor I recognized was, just like we have prevention strategies to have a good physical health and promote physical health, we have prevention strategies also for having good mental health. And so if we could bring in those two things, there could be some shift, is what my thought was. And that's kind of what led to the formation or starting this nonprofit Tarika Foundation. This was in 2017. I was like, have to work on something larger than what I do in my practice. And so two other like-minded child psychiatrists, my colleagues, came on board, and we were able to form this foundation and have been doing a lot of education work in schools. And I won't take too much time about talking about Tarika. We have a lot of things that we've been doing. It's my side gig. So I Monday through Thursday, I do long days in my practice, and then Friday and Saturday, and over the weekend, essentially, some work for Tarika, and thanks to adult ambassadors and board members like Poonam for giving me the back to do more work and giving similar opportunities. So that's me. I'm going to move forward with our, oh, let's see, why am I not able to switch the slide? Oh, there we go. Okay. Um, so the topic that we were thinking about doing this time came about to be around parenting. Parenting is a very, very fun journey and a very like rewarding journey in some ways, but it is also daunting. And we all have difficulties and challenges with parenting, particularly because we are like also juggling multiple balls, playing different roles. Like some of you mentioned in the poll, like, you're trying to manage work, but your child is sick, or you got sick, or, there is so many things you're trying to balance, and it's really hard to keep your emotional health intact when you have demands from every possible angle. So, we really thought that giving some tools around parenting would be a great way to start this year. And so came up with the topic of mindful parenting. And, I personally, I'm a parent of an 18-year-old. So I just recently became an empty nester. I have just one daughter. She's in college now. But throughout my parenting journey with her, when she was with us more full time, I learned a lot from working with her than I learned in my training, I would say. And then ever since I dabbed my feet into mindfulness and kind of learned more about teaching mindfulness, I really realized that there was so much that can be drawn from that practice as a foundation. That can be your foundation, and then other skill sets and other changes can really make a big difference if you have this foundation. So as you can see, our vision is to certainly help you guys be more nurturing, compassionate, fostering your and your child's emotional well-being, and building resilience. And overall, how would we do this? We will really focus on learning some skills that are foundational skills, which starts with self-awareness. How do I become first aware before I start to become more interested in making a change? So there will be a few different things we'll be focusing on in this 8-week series, touching on different foundational skills around mindfulness, and then, of course, giving you some hands-on tools to regulate your emotions, practice compassion for self and your child. And hopefully you will walk away at the end of it feeling like you have a few more things in your toolkit that you can use and make this journey more fun. So, as I was saying earlier, parenting is stressful, especially how rapidly the world has changed in the last couple decades with technology and digital media. There's a lot more a different world than what you and I grew up in. Our kids are growing, so there is a lot of nuances and challenges that this fast change has brought, and of course it's stressful. To kind of navigate through that world. And so uh, we want to first be aware of that. Yes, even though I'm not seeing any obvious signs of stress, we don't want to wait till it impacts our physical health and then we realize, oh my gosh, the stress was building and now I have a physical ailment. We want to try to be aware of, how we can become more aware of day-to-day stress, how we can then use mindfulness practices and self-care practices to manage that. So, what is mindful parenting? I know the mindfulness word has received a lot of attention in the last 5 years or even a decade. Even like everybody's like, oh, I know there's this buzzword going around everywhere, but how do I do that? And how does that tie into parenting? And so, of course, that would be the focus to get you grounded and understand more about what is mindfulness. And today's session would be a start for that. But, the concept of mindfulness is to be in the moment, be in the present, be in the present with full attention, awareness, and intention and compassion. So I'll tell you about one definition of mindfulness that has really resonated well with me. There is three parts to it. Mindfulness means being in the present moment with, you know, full attention and awareness, with kindness and curiosity. So there is aspects of not just I'm trying to be present with my attention, but I'm also bringing in curiosity and kindness. And when I do that, I'm able to choose a response than react. So that's like the general, like, simpler way of understanding mindfulness. And I'll probably try to give you an example to maybe help you understand this. So so let's say, I am I was I can I'm like focused on my slides. If I were to expand and see who all are listening or whatever, I can, you know try to bring my focus there. And if I realize, like, oh, there's no great reactions I'm getting yet, there's no kudos sign, no, whatever, and I'm forming this, as or I'm assuming or forming this, thinking that no one is interested in me. I woke up early on a Friday morning to be present for them, and here is what I get: no encouragement, no signs of, people listening or chiming, whatever. So when I'm not practicing mindfulness, I can really get caught in those thoughts, even though I'm like noticing those thoughts. And then I can come to this reactive response of, like, nobody's valuing me, nobody cares, why do I have to put in so much effort? Do I really want to do this? But that's what, happens when I'm not being mindful, right? But if I'm bringing my components of kindness and curiosity now as a layer to being in this presentation, and I'm being kind and saying, yeah, some people may be just, distracted by the work commitment they have, or they may have family commitments that are pulling them. Or I'm being curious, what might be going on for, Poonam, or, Shweta, or somebody who's on the presentation or this call, uh, in besides their goal to attend this and make the most of this. Maybe, they are, having a deadline for a project today that they need to submit, so they are distracted, whatever. So once I bring in that element of kindness and curiosity, my ability to judge, which is a very common tendency we have, we judge, we assume, we conclude, we form an opinion and judgment, and we go by that. And that's what drives those feelings of anger, frustration, and then a reactive response of lashing out or saying something that I didn't intended to, or doing something I didn't want to. So the moment I bring that kindness and curiosity component, not just being present, but I'm also like, okay, what else might be going on here? What could be some reasons that I can be kind to myself right now and say, okay, so what, you woke up early, this is something you want to do, you're passionate about it, so you're doing it because you want to do it, not because people should appreciate it, whatever. So what I'm saying is, when I bring in those components, I'm starting to think beyond that one fixed thought that came to me where I'm feeling insulted or disrespected or not valued. And then I'm like, okay, there is more here. And so that is the thing we will be kind of, I guess, working on honing. That was something I started to learn and practice over the years more and more, to have that, you know, kind of that pause in between my response or reaction, right? So when I bring in mindfulness, when I build that self-awareness, not just about what's happening in my body, but in my thoughts, in my feelings, bring kindness and curiosity about what else could be going on, then I'm actually able to see a variety of response I can choose from. And that's kind of what we can translate in our parenting moments as well, right? That's what mindful parenting means. And of course, we'll come up with examples in a bit to talk about specific parenting scenarios where I can be not mindful or mindful. How does that change when I start practicing being mindful? And how does that change my emotional response, my emotional regulation, and how that, in fact, then helps me have a more deeper connection with my child? So hopefully that gave you a little bit of a flavor. Of course, we will be, working on this. So again, there is a lot of like positive words in this slide, right? Our goal is to get you to a place where you're attentive, you're engaged, you're curious, you're grounded, you're observing, you're accepting, you're patient, you're being calm and loving and caring around the chaos that we are in, right? Around the mixed feelings that we all have ourselves and your child may be having. So how do we kind of navigate through tough moments like that? So, like I said, the key components of mindful parenting are, you know, awareness. That's the first step. And I like how it's broken down to simplify how do I get there, because it may sound like being aware is probably a very hard task. How do I like just be aware, because I have so much going on in my head about 10 different things I have to get to do. So what we understand is that cultivating that awareness through using your breath as an anchor is one of the initial steps. And I'll walk you guys through an exercise. And when you practice that more about using your breath as an anchor to come to the present moment, and then getting in tuned into what's happening in your inner world in terms of physical sensations, in terms of thoughts, in terms of feelings, that's the way you're training that attention muscle. That's the way you're training that self-awareness to start to come up easily to you. And once we are able to get there, when we are able to become more self-aware, then of course we are more in tuned into what my thoughts are, what my feelings are, what's coming up right now, what distress am I noticing right now when my child just rudely talked to me? So, and how do I regulate my emotional distress at that moment in a way that I have a positive interaction still? Because, it's easy to get carried away by that emotional response that we may have in that moment of like, how dare they disrespect or talk back like that to me? And I can in that emotional reactivity phase can get, say, like, get into that domination paradigm and say, you are not, I mean, again, I'm not saying like you allow your kids to walk over you. I'll it's a balance, but what we have learned, particularly for interactions with teens when they are trying to individuate and separate and become an individual themselves, the more you um, try to bring that domination paradigm and shame them or insult them or demean them. Again, it's, you know, I will be, of course, talking to you how we do it skillfully, where, they are still supposed to be respecting you, but that actually approach is counterproductive. We have learned over and again that that approach is counterproductive because it just ruins your relationship with the teen over and over again. And if I can, in that moment of hurt and pain that I've felt because of the disrespect I perceived from my child, if I'm able to regulate my emotion, if I'm able to have some compassion towards myself and the child, Like, oh, maybe they are having a rough day. Maybe they haven't gotten enough sleep. Maybe they are stressed about their homework. Maybe what? Bring that compassion, curiosity, kindness, and non-judgment, and have an ability to take a pause there. Then I can still address the problems. I'm not, again, yeah, I'm not like going to take it and say, okay, oh, because they were stressed, it's okay, they disrespected me, they can keep doing this always. But, how can I take a pause and then listen, and openly then I can communicate and tell them, I understand you're stressed about your test today, but that does not mean you break the values we have in the family about respect, something like that. But if I do that in a calm manner, in a respectful manner, I'm modeling that for my child. The child is learning that there is a way to resolve a conflict in a more calm, respectful manner. And I'm also treating them equal and not putting them down and saying, you don't do that, like that. So easier said than done, but that's what we are going to do. And the more you start training that attention muscle, building that self-awareness, the easier these next steps of emotional regulation, compassion, non-judgment, active listening, all those start to flow. Of course, there's been lots of benefits we are learning about mindful parenting in research, which is why we've chosen this topic, and which is why we believe that this works, and that's why have taken effort to learn more about it, so we can practice together. So as you can see, there is a lot of positive sequel that follows when you do this. So I want to, give you a little bit of an experiential feel for how mindfulness can be practiced. We'll be doing different types of mindfulness exercises in each of these sessions. There's many different ways you can practice mindfulness. In fact, you can be mindful in anything and everything you do. So it can be mindful eating, mindful listening, mindful dancing, mindful stretching, mindful whatever you're doing. Essentially, you're bringing your full awareness in that moment and being in there. But for today's starting kind of activity, or starting kind of way of experiencing mindfulness, we are going to, like I mentioned earlier, practice some mindful breathing using breath as an anchor for us to really ground ourselves, to come to the moment, to be in the present. So I'm going to, maybe do a few different ones for you to see which one clicks well for you. Everybody has like one particular type of breathing they appreciate, or one tangible way of doing mindful breathing they appreciate. So, I have listed a couple on the slide here, but I'll walk you through, guys. So I hope everybody's feeling ready to do that. Um, so I invite you all to sit comfortably, and if it's comfortable for you, close your eyes. If it seems I'm not ready to close my eyes, that doesn't work for me, that's totally fine. Found like a neutral spot to look at, have a downward gaze. And then slowly start tuning your attention to your breath. So as you start paying close attention to your inhalation, inhale at the count of 1, 2, 3, 4. Hold for 1, 2, 3, 4. And exhale gradually at the count of 1, 2, 3, 4, 5, 6. So we understand that between inhalation and exhalation needs to be more slow and deeper. That's when we are actually practicing abdominal breathing, which is what really helps kind of ground. So I'll share like a scientific reasoning for that. Normally, when we are just breathing, we do very shallow breathing. We are just using our lungs to breathe. And when we are stressed, actually, it's been found that we don't really breathe even shallow. That's, something that happens when we are stressed. Our sympathetic system just, takes over, and we kind of get zoned in what we are doing, and we forget to even breathe properly. So making a conscious effort to have deep breathing, filling your lungs like a balloon. And when we do that, when your lungs are fully expanding, they push this muscle, the diaphragm, down. And you can also feel like, oh, now I have like air in my belly. So that's a deep inhalation or deep inhale. And then you can hold for a couple counts and then exhale gradually. So when we push our diaphragm with that deep inhale, there is vagus nerve, which is our parasympathetic nervous system, which is what is a cooling system, a grounding system, a calming system of our body. So when we do that deep breath and we are stimulating that diaphragm muscle, the vagal nerve in that muscle is what gets activated. And that gives the brain a message to say all is well. You're just, so I'm weaving in some explanation for you guys to have a greater understanding about why deep breathing or abdominal breathing is necessary. So now I will ask you to bring your hand in front of you. You can actually open your eyes for this. And we are going to do what we call as 5-finger breathing. Sometimes people find it hard to just like breathe, inhale, exhale, and hard to keep track of the counts. So what we will do in this is we're going to start at the tip of the thumb. And as we are moving our right index finger on the left thumb, when you're moving it up, you're inhaling. And as you're bringing the finger down, you're exhaling. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale and exhale. And you can, do this just inhale, exhale, like we did using your fingers to help you track that breath count. You can also, do the pause here. So you can inhale, come to the tip of your thumb, hold the breath for a second, and then exhale. Inhale, hold, exhale. Inhale, hold, exhale. So you guys get that. So the 5-finger breathing is a nice way also like to do it even, when you are like in the middle of the day doing different things. If you're attending a meeting or something where you're a passive participant, you can even just like, okay, let me kind of just breathe. And because like I said, when we are in tuned into doing day-to-day work and stress, we forget to breathe properly. So reminding ourselves to using this breath as an anchor, training that muscle of tuning into your breath and feeling grounded is one way to be mindful. And obviously, when you're trying to use breathing exercises, whether you're doing that 4 square breath, there's a 4 square, so you're imagining a square, breathing in on once and then hold, breathing out, hold, breathing in, hold. So there's 4 square breathing, there is 5-finger breathing. There is many different ways you can find the breathing, exercises to be helpful to be mindful. Of course, when we are doing these, I'm sure you notice your mind is wandering. And one thing that I like from one of the commentaries I practice is if I'm really in tuned into my breath for a few seconds or in a minute's time, if I'm starting to feel like, okay, I've really found myself really, in a good rhythm of inhale, exhale, and you're thinking of like, oh, I have to do this, I have to do that, you can just make a mental note and say wandering and come back to your breath. Okay, so I want to take a minute to do this all, put this all together. I kind of gave you a lot of explanation in between, so we didn't really do like a proper breathing exercise. We'll just do one practice. I have a tone bar here. So I'm going to start the practice with ringing the tone bar or the singing bowl and end with that after we finish that 1 minute of kind of being mindful, using our breath as an anchor. I hope you guys can listen to it. If you can't, that's fine. I invite you all to sit in a comfortable position. Close your eyes if you're comfortable, or find a neutral spot with a downward gaze. If you can, bring your hand to your belly and start becoming aware of your breath. Noticing when you breathe in, you're inhaling cool air, going through your nose, filling up your lungs like a balloon. And you notice your belly rising. And slowly you're breathing out. Breathing out fully, slowly. Noticing when you do that, your belly sinks. Breathe in, belly rising. Breathe out, your belly goes down. You can stretch your imagination, and this is something you can do with your kids. Imagine now that your hand is like a boat and your belly is representing an ocean. And as you're breathing in and out, the boat goes up and goes down with the waves. Breathing in, the boat moves up, and then the wave goes down, and the belly sinks, and the boat goes down. If your mind's wandering, just say wander and come back to feeling your breath. If you notice a thought, you can also use a word like later. You're fully bringing back your attention to your breathing, noticing what's happening in your body. What physical sensations are you starting to notice as you're getting more in tuned to your inner world? Maybe you're noticing a tingle somewhere. Maybe you're noticing a pain. Maybe your body feels calm. Whatever it is, just make a note and continue to bring your attention back to the breath. Taking a moment to appreciate a couple more breaths. In a moment, I'm going to ring the singing bowl again. And when you no longer can hear the sound, gently open your eyes if you've closed them and bring yourself back into the meeting. Great, thank you. I hope everybody was able to tune in. Um, I tend to talk a lot and